Hi, welcome to the AIM on MS&T podcast. If this is your first time listening to our podcast, first off, welcome. Second, AIM stands for Academia, Industry, and Military, which are the main sectors that make up Central Florida's modeling, simulation, and training community. We talk with different leaders in this community. We also hit on all the cool and innovative things their organizations are doing, trends that affect the MS&T field as a whole, and keep you up to date with what's going on. If you're not a part of the modeling and simulation community, we hope to share some insights about this important sector of Orlando's economy, which ranks just behind the theme park and hospitality industries. I'm your host, Kate Finkel, and today our guest is Jude Tomasello, Program Manager for the Defense Health Agency's Medical Simulation and Training Program Management Office. Jude, thank you for joining us today. To start off, for anyone listening who isn't familiar with who you are, can you please introduce yourself, give us your background, and what you do?
Yes, thank you, Kate. I'm Jude Tomasello. I am Defense Health Agency's Program Manager for Medical Simulation and Training right here in Central Florida in the Research Park. As far as my background, I was hired in 1987 right out of college as an electronics engineer for what was then the Naval Training Systems Center, which later became NAWC TSD. It was so long ago, my first workstation was a Z100 with a green phosphor screen and separate floppy disks for the operating system and the application, and some of the old timers will know exactly what I'm talking about. My first assignment was on the Trident submarine command and control trainers, and that was a great start to a fantastic career. In 1995, I went to work for what was then Stricom, is now PEO Stry. Like many engineers were doing at the time, migrating from the Navy to the Army, it just seemed that opportunities were better on the Army side, and that certainly proved to be the case with me. I worked my way up to lead systems engineer on a very large program, and then around 2000, 2001 transitioned to the PM side. Seemed like a natural evolution. I worked my way up to the Deputy Program Manager in Field Ops, and then in 2016, I was asked to support PEO Stry's new medical PM as their deputy, so I moved there. We transitioned to DHA in 2020, right in the middle of the pandemic, and like PEO Stry and NAWC TSD, we are an acquisition organization, pretty much doing the same things the same way, except our focus is obviously medical simulation, what we do. We take requirements, turn them into capabilities or services using the DoD acquisition process in partnership with our industry folks out there. We contract for design, development, production, testing, fielding, and sustainment of medical simulators and systems across the military health system. So again, you can see there's a lot of overlap and commonality with what's done here from the Army and the Navy.
And now that we have a little bit more insight on who you are and what you do, let's get started. Today, we see the medical simulation working in every area of the medical field. It is my understanding that a lot of this technology was started right here in Central Florida. Can you please tell me about how you are involved with all of that?
Yes, absolutely. Military medical simulation has its roots right here in Central Florida, and specifically with the Army, with PEO Stry. Around 2005, Stry worked with the Army Medical Command and with the Department of the Army to draft an urgent needs statement for the Medical Simulation Training Centers, or MISTIC as they have long become known by. PEO Stry designed, developed, produced, fielded, and sustains these systems to this day, and that's across the Army, the active Army, National Guard, and Reserves. They have trained many medics and combat lifesavers, and countless lives were saved from this system, the benefits received from this system. Several years ago, our partners over at the Simulation and Training Technology Center developed a tetherless mannequin that is the standard today. Before that, there was a giant, many cables bundled into one giant cable. It was very cumbersome, and it limited training and what you could do and where and how you could do it. But this tetherless mannequin was a complete game changer. And in fact, many advancements in mannequin or human form technologies come from the local industry supporting the sim community right here in Central Florida.
This leads us nicely into our next discussion about some of the major successes from Team Orlando that happen because services come together because they want to work together, not because they are told to. How did your organization become a joint one here in Team Orlando, and also what is the DHA's mission?
So we were a program manager under PEO Strive from 2016 until 2020, as I said earlier, and then we transitioned to DHA as planned. Our mission in MS&T here is simply to improve healthcare and build readiness through simulation, training, and education. And we do this by using the same acquisition processes we learned over on the Army side, but now our stakeholders are all services. We're a joint program office, the combatant commands like SOCOM or AFRICOM, and the military treatment facilities or the military hospitals. We support active duty service members and their dependents by ensuring the providers and the provider teams are trained and ready. DHA is very, very big on readiness and emphasis on readiness. The previous commander, under every briefing slide, their slogan was a ready medical force and a medically ready force. So readiness is big at DHA. And in our office, we support both the clinical and the operational side, and that's kind of rare to have both of those under your portfolio at DHA. And we take great pride in this, and it's no small accomplishment. And I have to absolutely give credit to my team of outstanding acquisition professionals, both civilian and contractor. Joint military medical simulation acquisition and contracting doesn't exist in this community without them, and I feel very strongly about that. Finally, I want to point out our great partnership with PEO Strive. We're here doing this podcast in Partnership 3. Well, through a 5-year support agreement with PEO Strive, we lease this facility from them. We pay for our IT services, we pay for our security services with a 5-year support agreement. So when we transitioned from Strive to DHA, really the only thing that changed was my chain of command is now at DHA headquarters and not with PEO Strive. Offices, equipment, everything stayed the same, and it really as seamless a transition as you could get, and Strive's been a great partner for us.
On a related note, medical simulation is so important for saving time, money, and lives. Can you point out 1 or 2 programs that have really been the legacy of DHA?
Sure. I like to think all MS&T programs are special in that they save lives and they enable great training, and this in turn enables peak readiness, as I said before, and a ready medical force. But one program in particular I want to point out is the Complex Obstetrics Emergency Simulation System, or COES, as it's known as. Believe it or not, infant mortality rates are rising in this country, and the military hospitals are indicative of that. They're also seeing trends in the wrong direction. So as a result, a couple of years ago, a requirement was generated out of DHA to design and deliver a simulation system to ensure obstetric providers, and this is both individuals and teams, because we work largely in teams, are better trained and ready to deal with serious complications before, during, and after delivery. The birthing simulators are very realistic, and COES also has a robust learning management system, so you can measure and improve not only the trainee effectiveness, but the system itself. Yeah, so it's kind of continues to report about itself so that we can make improvements and continuously better the system. And for me, there's no question about it. This system will save lives of those most vulnerable.
Building on what we've been discussing, you stood up the DHA office and aligned it with Team Orlando. Why did you feel that was so important, and how did it help the DHA as well as Team Orlando organizations?
Yeah, so I wanted DHA and our contribution to medical simulation to be recognized in the community here. They recognized it on the Army side, and that's kind of a niche thing with the Medical Simulation Training Center. But again, we're across all services, combatant commands, and the military hospitals, and that was not well known here. So my goal was to kind of spread the word. I know pretty much all the Team Orlando organizations and people through many years of doing this, so introducing them to DHA was relatively easy. And I believe Team Orlando serves this community very well with the synergies and the opportunities that they facilitate between the government, military, academia, and industry. And I see that all the time, and they do it very well. Obviously, it's important to us for us to be involved in contributing to that. So, and I hope that continues after I'm gone.
Can you also speak a little bit to industry? How has industry helped advance technology, and do you have any advice for the others in the field?
What's interesting is that 10 years ago, there might be one medical simulation booth in all of ITSIC. Now there's industry reps and medical simulation booths in every aisle, sometimes multiples in a single aisle. There's even a medical simulation corner in ITSIC that's been showcased there for several years now. And that's industry and government combined in that area. It's not limited. There are conferences like the International Medical Simulation in Healthcare that's held here, usually January timeframe, IMSH. That's devoted only to medical simulation. We call it the medical simulation ITSIC because it's that big.
Yeah.
And the other thing is, our simulations aren't weapon systems. It's not a tank. It's not a helicopter. The customer base lies outside of DoD and within DoD. So we have a very wide customer base, obviously from the commercial market of medical simulation, and we do cross over into that civilian sector. We've exchanged informations and are working collaboration opportunities with Advent Health and the Mayo Clinic. We went and visited Mayo Clinic last month and then went over the bridge and met with the Naval Hospital folks there.
Nice.
Actually facilitated the Mayo Clinic and the Naval Hospital folks getting together, which they had been trying to do, so we were kind of a matchmaker in making that happen.
Mm-hmm.
And industry has ample opportunities right here in Central Florida with the hospital networks, UCF Nursing School, one of the best in the country, as well as state and local governments. And I'd recommend to anyone in industry that they actively engage the civilian market. It's a win-win.
As we wrap up this topic, I want to ask, from all your years at DHA, PEO STRI, and the Navy, can you talk about one or two of your proudest moments or accomplishments and what makes them so special?
Yeah, because of what we do, it's kind of a proud continuum, right? And it's always there, and we call that the why, and we know who we support, and we know what we have to do to support them. But we believe and we've seen that the simulation and training enables our military to achieve and hold peak readiness, whether it's on the combat arms side or the medical side. Training is readiness, and readiness means you're improving your chances of success and coming back alive. And when they succeed, our nation succeeds, and their chances of returning safely to their families go up exponentially. And what could be better than that? One memory that especially stands out, I spent a little bit of time in the Middle East at Camp Buehring in Kuwait, and I was head of the training village there. And one day, I believe he was a master sergeant, came up to me, and the guy had just come back. He was training because it's a training village, but full of the dust that you get in the desert. He had his M4 strapped to his back, and he was looking for me, knowing that I was the guy that was responsible for all the operations there at the village. And sought me out and how can I help you? And he said, I just wanted to tell you that the training I received here on the Medical Simulation Training Center was used to save my life, and I used it to save my buddy's life.
Oh, wow.
And I get chills, and you can't get any, it doesn't get any better than that.
Right.
When they come up and find you and say, it's not as though, I was able to hit the target. It saved my life, and I saved his life.
That's amazing.
So it's very special. Yeah.
Aww. And now, for our listeners who are thinking about going into a field like yours, what is some advice you can give them, or something you wish someone had told you when you were first starting out?
I've had great mentors throughout my career, and it's been a 37-year career. Some were aware they were mentors, and some weren't. I would just kind of track them, I observed their behaviors and their methods, and I used what I thought best suited me and my trajectory for my career. These may sound like cliches, but advice I would give is something like this. Always be observing and learning. Learn outside of your comfort zone or your area of expertise. That's growth. Know the big picture and how you fit. If you're a budget analyst or if you're a contracting person, I think it would only do you good and do the entire program good if you knew those other pieces as well. Do what you're told, but also do more than that. Do what you're not told, and if you understand how you fit, then you can do those things and contribute at levels I think that are fantastic. Take initiative, be self-starting, embrace innovation, things that in any sector of society, if you did, you would succeed. And learn and practice critical thinking. A lot of times now, especially with social media or any of the other sources of information or misinformation that are out there, people just take it for face value and it becomes their thought. Well, we all have brains and we can all process things, and we do process things differently, but put your own spin on it and, what do you think and why, and continuously ask why, and ask that not only of yourself but of your peers as well. I think it's okay to question a task, and you do so professionally, but it's like, hey, sir or ma'am, what did you mean by that? What if I did it this way? Or what if we thought about it another way? That to me is productive. And again, you do that, professionally.
Yeah.
Sometimes they'll say, nope, just go do it, and you do it. Especially we're in a military-based community here, so chain of command and following orders is important. And then, it helps if you have supporting data. It's easy to go get the data now, relatively easy. So that always helps. I read somewhere someone said, without data, it's just an opinion. And so if you've got data, it becomes fact, and it becomes something you can back up.
Right.
And then finally, never compromise your integrity. And there's lots of opportunities to do that, especially in acquisition, but never compromise your integrity.
That's great advice. Thank you for saying that. Now, shifting our focus a little bit, you're coming up on your retirement in a few weeks. Congratulations on your amazing career. What is next for you?
So it's in 6 days now. So
Yeah.
I know the storm, and we had some delays on getting this podcast together, but yeah, it's this coming Wednesday, October 30th. So thank you for those kind words. My wife and I plan to travel and enjoy the holidays like we typically do. But in January, I plan to hit the ground as a consultant in this community, helping industry learn and grow and become more successful in their endeavors. And I also plan to be active in supporting Team Orlando as well.
Again, congratulations. Is there anything else you'd like to add before we sign this episode off?
Yeah, I want to thank Mary and Team Orlando for this opportunity. Mary and Ed have a special place in my heart, and Mary, I know you know that. I so enjoy telling folks about who we are and what we do and how my team is second to none. So thanks again for allowing me this one last time as a government PM to do this.
Well, Jude, thank you for sharing your story and answering some questions for us today. For everyone listening, to keep you updated on future events in the modeling and simulation community, check out our website, teamorlando.org. You'll also find us on LinkedIn, Twitter, and Facebook for more recent news and upcoming events. If you are interested in sponsoring an episode of AIM on MS&T or being a featured guest, please reach out to Team Orlando News. The link will be below. We are now going to wrap up this episode. Again, I'd like to thank our guest, Jude Tomasello, Program Manager for Medical Simulation and Training at the Defense Health Agency. We hope you enjoyed this episode. Don't forget to follow the AIM on MS&T podcast on your platform of choice, and we will see you on the next one. Bye!